100 beneficiaries from Amawbia community, Oka South Council area, have been enrolled into the Anambra State Health Insurance Scheme. The beneficiaries were selected from the 6 villages of the community and are made up of underprivileged men and women of the area. Paul Izuke filed the report.
The enrollment took place at the Amawbia Town Hall. Addressing the beneficiaries, the Executive Secretary of Anambra State Health Insurance Agency, ASHA, Dr. Simeon Onyemechi, explained that the scheme will enable them to access quality healthcare services at any selected health facility of their choice at very little cost. Dr. Onyemechi made it clear that the beneficiaries with ASHA identity card should not pay consultancy or registration fee of any kind and should not also pay for laboratory services to diagnose their type of MS, while ASHA also covers 15 days of admission in hospital and 21 days in surgery-related admissions. He said Anambra State Health Insurance Agency does not cover cancer-related MS, while the agency will help to link beneficiaries to hospitals where they could access treatment for illnesses not covered in the policy at reduced cost. Dr. Emechi expressed satisfaction that the Anambra State Health Insurance Agency adoption model, where privileged individuals pay for underprivileged individuals, is presently being emulated by many states, including Oyo, Osun, Nasarawa, Delta, and other states, while the National Health Insurance Administration Bill before the National Assembly contains the adoption model as a method of getting informal sector to participate actively in the scheme.
Last year, we decided to create what we call adoption model, where privileged individuals will pay for the less privileged in the various communities. Like the model Amawbia people have decided to do today, you see that they crisscrossed across the 6 villages in Amawbia, led by the Ugeze, wife of the traditional ruler here. Lolo organized the women and got them to reach out to their privileged sons and daughters who are whether home or abroad. And they contributed money and they selected indigent individuals from across the entire Amawbia town to do this.
In her remarks, the coordinator of the program in the community, Mrs. Rita Chike Odmodu, said the leaders of the various villages and other stakeholders helped to select indigent members of the community for the scheme.
100 people, like you said, will be enrolled today. And it was made possible. First of all, it was our Lolo, Ugeze, Igwe's wife, that brought up the idea. And we went to a lot of Amawbians and we pleaded with them to help us register some people who cannot afford to go through this insurance. And they really responded. A lot of them did. And as a matter of fact, this is a collective effort of the prominent men and women of Amawbia, and we really appreciate their efforts.
In their separate reactions, some of the beneficiaries, including Mrs. Grace Awuzulibo and Mr. Kana Okolo, thanked the state government for the initiative, which they said is impacting positively on lives of the people.
Even when you watch the noise in Mabulon, again, doctor. When I see, for example, no bolo na mother June ogo away 9,000 naira. Na 10% go and that 10% go 600 naira. So I'm very, very grateful to the government.
From Amawbia in Oka South Council area, Paul Izuke, ABS News.